36-year-old woman comes to the physician because of a 2-month history of progressively worsening lower back pain and weakness in the lower extremities. The pain is worse with movement and improves with lying down on a flat surface. And she was diagnosed with pulmonary tuberculosis 6 months ago and is currently taking isoniazid and rifampin. Physical examination shows sensory loss where the anterolateral aspect of the lower thigh, patella, and medial aspect of the right lower leg. Strength 2 out of 5 with knee extension and patellar reflex is absent. An X-ray of the spine shows a paravertebral opacity with anterior wedging of the vertebral body. Which of the following nerve roots is most likely to be affected in this patient? Okay, so this question also we have, okay, so I have a pretty good diagram which you can help with this particular question. So let me just share that with you guys. Yes. So here we can see that mostly tested nerve roots are these, okay? So how to differentiate between them? So whenever there is L4 involvement, so it's not very important to know the sensory distribution. I mean, it's really good if you know, but there's an easy way. Obviously, when there is decreased patellar reflex, go for L4. So if the question says decreased patellar reflex, go for L4. If the question says decreased Achilles tendon reflex or the plantar reflex, go for S1. Okay, so L5 does not have any reflexes associated with it, but you can see there is weakness of dorsiflexion. Okay, so and sensory distribution, if possible, try to remember it, but mostly with the help of these reflexes that are affected, we could make, yeah, so we could come to a conclusion. Okay, so here we can see that's the anterior part of the thigh with the medial part of the leg that is affected. So the anterior thigh with the medial part of the leg which is affected, go for L4, and L5 is the lateral part of the leg. And when it comes to S1, it becomes a little bit more posterior and lateral part. So think about that way. So the most important things to look for here is if any reflexes are being affected. Okay, so let's get back to the question. So if it is L5, we've already discussed. Here the patient says that she has patellar reflexes absent, right? So L5, we already saw that there is no reflex involvement. And if it is S2, usually there is a perineal involvement. Okay, so if they could mention about urine or fecal incontinence or something like that, something to do with the perineum is mostly associated with S2 nerve root involvement. And S1, we've seen that it is the plantar reflex which is affected, and L4 is patellar reflex, and L3 is also a nerve root which is a root of the femoral nerve. But the thing is that if such a question come and the patellar reflex is absent, the main component is L4. So I would suggest to go with L4 as the answer. So if it is L3, usually there is diminished patellar reflex. Absent patellar reflex in most of the situations is associated with L4 nerve root. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.